We're starting to look at playing surfaces, shoe size, shoe wear. So there's a lot of different things that we're investigating in the research arena, but clearly, do we have sort of one thing that we say, you know, this is it, let's do this, and we won't have these injuries? Sorry to say, we're just not there yet. So we still see a tremendous amount of more ACL injuries that need surgery in the female population than the male population, specifically as it relates to high school and collegiate kids. And, you know, interestingly enough, the reason why I think it is important is probably a third of all the ACL injuries in the country, which is maybe about, you know, 200, 250,000 a year, are in high school kids. So if you think about that, you say, wow, that's a severe injury in a high school kid that is just starting their activity level. It's concerning from our standpoint.
So is there any kind of preventive measures out there that have been studied or are in place that coaches or parents can do to help with this?
I think we're probably about 5 years into looking at that, and what we're starting to do, and we're particularly looking at it in the female risk group, because we think maybe that's a group that if we study, because of the numbers, just the sheer numbers, we can look at it and compare and say, are we making progress or not? And there are some things, as I mentioned earlier, about the jumping, the landing, the training they do, whether it be preseason, so it could be a, you know, for instance, in college and even in high school before they start nowadays, there's a training period before games actually start. And what we've done is we've looked at groups of players, say a team, and we've instituted specific training programs and how they train. And it seems to have been having an effect. We have been able to decrease the incidence of that dreaded ACL tear. The problem is time. Where do you find time to do this? The coach wants their time, if you know what I mean, and their time is practicing to get better. It might not be the training part of it. So you have to sort of fit that in to also what they're doing. You know, an example of how we may do that better in the future is though every team, whether it be, you know, local soccer at the U10 level versus the high school collegiate level, every team has a warm-up period. And I think most of us have been there and watched those warm-up periods. Can we do a better job of getting those muscle groups warmed up to prevent an ACL tear during the game? For example, there's a thing called, we use the term muscle memory. Kind of, if you think about it, it makes sense. If you train your muscle to do a thing a certain way, maybe during the activity or the game, it'll remember that way before the signal comes down from the brain for that muscle to activate when it needs to do. So we're trying to get everybody to understand that and get on board with those things. And it can be just as simple as that 45-minute warm-up period that I think every team takes. Now, how you use that time, now that's a different story.
Now, I know one school in town, the Paul Lawrence Dunbar girls soccer team, is doing something similar to this, a prehab program before practices. Tell us about this, because after you give your description, we're going to actually see it in place.
Yeah, I think, you know, we're fortunate enough to provide care to the Fayette County Public Schools, and it's important to us to make sure not only we provide care for the injuries that happen, but I think any parent, athlete, person involved, the first question is, well, how can we prevent that? So we've instituted this program that involves the athletic trainer, It involves the coach. You have to get them on board. So the educational piece is very important to let them know that we're not stealing their time, if you will, by taking away the soccer ball. But we're instituting that program to get them preseason into doing these things, and then before every game, and then even after the game, you can spend some time. If you watch high school sports, you notice a lot of teams now do stuff after the game. Might be not for that long, but we're instituting that as well. So we have instituted the program. It's in the very infant stage, I would say, because I don't think educationally wise, we have everybody on board understanding the things we're talking about today.
Okay, well, that's a good lead in. We're going to, just recently, we were at a soccer practice at Paul Lawrence Dunbar High School, thanks to Emily Coleman, the coach, who allowed us to visit out there, and the certified trainer is Aaron McDonald, and so now we'll hand it over to Aaron.
Hello, my name is Aaron McDonald. I'm the certified athletic trainer at Dunbar High School, and today we're going to be giving an example of the Dunbar varsity soccer team's ACL prevention and warm-up program. The first exercise we'll be doing is a high knee jog. This exercise is good for quad strength, balance, explosiveness, as well as to teach a proper landing. This is a high knee shuffle, which is also good for quad strength, quad flexibility, balance, explosiveness, as well as proper landing technique. Karaoke, facing this way. This is the karaoke exercise. This exercise is good for hip flexibility and foot quickness. The next exercise is a walking lunge. This exercise will be done both forward and backwards. This exercise is for glute, quad, and hamstring strength, as well as lower leg and lower body flexibility. The next exercise is a straight leg kick. And this exercise is done to improve the quad and hamstring flexibility.